Okay, I'm a doctor. And I've been a doctor now almost 30 years. And the reason why I became a doctor was because my mother was a doctor, my dad was a doctor, and all I could see was that they wanted to help people. They wanted to make people feel better, and they wanted to improve their lot in life, whatever that meant. And that was sort of a feeling that both my brother and I got, that you just really couldn't be a happy, productive human being unless you dedicated your life to medicine.
When Molly was first diagnosed with breast cancer in 1997, I didn't really know anything about the law. When she started into chemotherapy in 1998, the only thing that I really knew at that point is you could have a written oral recommendation. Once we were asked to start looking into doing recommendations, I read the law, talked with Dr. Todd Mikaria, who had a bunch of documents already put together. I did research into the cases that had been decided at that point about medical marijuana.
It was the cops who determined whether or not I'd go into business. And they were just like, well, we don't know how to tell the difference between someone who's just smoking dope and someone who's really sick, Dr. Fry. Could you help us out? And I'm thinking, you really want me to start a business where I'm evaluating people? I mean, shock was the only word I could say.
And I tried to find out what, if anything, was being done around the state at that point with respect to guidelines for people to grow. Now, I found out that there was very little that was known. The Attorney General had put out a list of guidelines from around the state, but there's 58 counties in California, and there were maybe 15 or 20 guidelines out there, and they had a lot of overlap. So most places didn't have guidelines of what to do.
And I'm not going to treat anyone for being black, blue, purple, green, or yellow any different than I'm going to treat someone who's a boy or a girl or any other difference that might come from the variation that exists on our planet. I am a doctor to treat human suffering. I saw tremendous human suffering with the diseases that marijuana appears to be really good at containing, like anorexia, nausea, wasting of AIDS, and then there's the anti-inflammatory properties where it helps people with asthma and rheumatoid arthritis and lupus, and then there's the other inflammatory conditions like MS that they still haven't enough research. And ask yourself, the doctors have known about this, the scientists have known about this since the 80s. And yet the government will not allow us to research it, so they say, oh, well, there's no real clear research that marijuana is useful. Well, if you don't classify marijuana as a Schedule II drug, making it available for doctors to research it, they can't research it.
So what I first did was to put together documentation that would verify that you had a recommendation from a physician. We had notarization to the doctor's signature so that we wouldn't have to go to court. Unfortunately, the law enforcement officers didn't care about that. They wanted to require the doctor to come to court to testify that she had in fact given you a recommendation. And that was another thing that we did. We were prepared to testify. Molly testified no less than 25 times in trials, and my recollection is that only one case was ever decided against the defendant, and that case was overturned on appeal. So she was very, very successful.
And I didn't like the fact I didn't have an office, and we solved that almost immediately as soon as my reputation got out. But initially, we had to go where the patients were before they'd come where I was. And the practice was more Dale's practice than it was mine. It was a legal problem, not a medical problem. This drug is safe. Let me repeat that. You can't say that about aspirin, or about Tylenol, or about Motrin. This drug is safe in any quantity. No overdose possible. Only a theoretical overdose of 1,500 pounds, and I think you'd do better if you dropped it on them.
Now, one of the things that I did was to begin to get involved with organizations around the state that were working on this, and we got an organization started in El Dorado County here where I live, and when I tried to find out what the guidelines were, I didn't get very far. The sheriff deputies would talk to me, but the district attorney wouldn't. I called him several times. He wouldn't return my phone calls, so there was an election to be taking place, And so I put my hat in the ring for district attorney, and that was one of the things I think that irritated law enforcement quite a bit. The thought that one of them might run for an office of law enforcement.
So during this period of growth and development, I also stayed home with my children and worked with my husband as a consultant, but basically was really focused on the miracle of children, the miracle of growth and development. And the next thing I knew, I had grown and developed a cancer, and it was threatening my life. And my youngest was 5, my oldest was 10. My mother died of cancer when I was very young. The tragedy was more than I could bear. And as a result, who knows how much your mind has to do with everything, but it does have a lot to do with things. I didn't take well to chemo. I vomited almost constantly. The doctors told my husband to get me marijuana, which he did, and that started the whole series of things that led to the policeman actually asking us to start a business. And the point that's most important is, in '99 when we started the business, I was walking toward the grave.
I have a hereditary condition called hemophilia, in which I bleed when I am excessively injured. Sometimes without excessive injury I bleed. Molly is a breast cancer survivor. We came to this movement because of illness, specifically Molly's breast cancer.
Because to me it wasn't a movement, to me it was a matter of life and death. If the doctor had said, your mommy needs lavender, I would have told my husband, you better grow some lavender, and everybody in this household better get up that hill and grow it for me because I'm sick.
The movement for medical marijuana is one that is not often left field, it's mainstream. The people that are doing this could be your mother, your father, your brother, your sister, could be your child.
And when you're walking toward the grave, you feel like if this is the last thing I ever do, I want to get someone's attention. And so I went into it with this kind of fireball attitude that I was going to be like my mother, flaming torch, and then dead in 2 years.
And Molly and I were advertising on the radio. We wanted people to know that our services were available and that they should be able to do this without fear. We had rallies at the state capitol where we talked to people. We went on to the news and we told them what we were doing.
Now in Europe, in England, in all over the world, people know the value of hemp and have known it for 6,000 years. Hemp could save our planet and marijuana could save our health. And people don't even realize that we all live on one little bitty globe and we're all going to live or die.
I think that all told, Molly and I got under their skin. We were a doctor and a lawyer who lend credence to the average person out there. If a doctor and lawyer are doing it, it must be okay. Our average patient was in their 40s. The average person or patient was a male, although there were a significant number of females. The average patient had chronic pain.
The reality is, when I have a drug that's safe, and I proved it in many different scientific experiments in 6,000 years, I kind of go with the safe drug.